Today's October 2nd, 2024, 10-2-2-4. Play that for the lottery. Jay Bhattacharya is with me. He's always fascinating. He's the essential man, brave and forthright and educated. Actually, the way our schools have been going and turning into kind of little mini Stalinist factories. I never said that, but you are still the exemplar of what a good education can do and what you can do for a good education, both. So you had a long standard, I think still have a long standard pedigree, Bachelor of Arts, Master's, PhD in economics, and an MD. What did all those degrees inform you when COVID came around, and what was kind of like the before and after? I mean, I think there was kind of a great awakening in a sense. They want the Great Reset. I think it's become a great awakening about what the credentialed classes did to and or for us. So there's not a question there, but maybe go down memory lane for us.
Well, first of all, Randy, thanks for having me on, and thanks for those kind words. It's always good to talk with you. I'm overeducated. Is that what you're trying to say, Randy?
No. You're the exemplar of appropriate education. I think you actually use all aspects of it. You have the PhD in economics, and I think that helps inform your medical sensibility and give perspective. I think people are kind of peppered with statistics, and they all think they're going to drop dead from the next thing that comes along. And I think there's a joke amongst economists. You can tell the economists have a sense of humor because he uses decimal points. So I think economics is not necessarily all that. There's a lot of flux and imprecision there. But I think your general point of view is reasonable in balancing effects. And I think that's part of economics, which is, I think the Greek word is basically study of the household. And so you have kind of a sensibility of studying the household without going too far on, we must stop, zero COVID, say. So
I think the key thing, I mean, there's a few things in that I think guide just sort of my worldview about how to think about things like the COVID crisis. So first of all, in economics, we should, anyways, have in our souls the idea that basically there's a trade-off in everything. There's no such thing as a free lunch. There's a trade-off in literally everything. So you have to think about those trade-offs, even for things that seem good, right? Let's control the spread of COVID. That seems good. But if what you do to control the spread of COVID ends up harming the poor, the working class, the vulnerable, and actually doesn't particularly work very well, controlling the spread of COVID, well, then you have to think about that. Even though it seems like a good goal, it's having a good goal is not enough. You have to think about the trade-offs. I don't practice medicine, but I did study medicine. I have an MD. That gave me an understanding of what it's like to be a patient, what it's like to face uncertainty as a doctor. That's one of the main things about being a third and fourth year medical student. You're deeply uncertain based because of your own limitations, but also because of the complexity of the things that you're dealing with your patients. It also gave me this appreciation that you should never be treating patients as numbers. They're human beings. They're people that have feelings and like goals that are different than yours. And again, there's a deep sense of trade-offs. Everything in medicine involves a trade-off. There's no such thing as a drug that has literally no side effects, except maybe placebo, and even that has some side effects, I would think. So I think, I think that those kinds of experiences in medical school, in my PhD in economics, it definitely colored my worldview, has colored my worldview, has colored how I think about a lot of things. But certainly the COVID response, it struck me as that those kinds of experiences were really useful in the way I think about things. It like shocked me that so many of my fellow doctors here at Stanford, and also many fellow economists, seem to forget about those things in 2020 when they were so scared about COVID.
So Dr. Fauci also has an MD and is also non-practicing. He lacks some of your other degrees, but I think he's historically a smart enough guy. I think he got academic accolades and he played on the basketball team, so point guard maybe. So he's probably a sharp enough guy, and was able to navigate the bureaucracy and et cetera, et cetera. He said some things about you. That you wanted to let the vaccine rip, as it were. And so a few other inaccuracies. here we have, somebody. Oh, I was also going to mention his. I've got two articles on Dr. Fauci in Brownstone, and the second one kind of covers his self-proclaimed DNA of caring. I don't know if that's the name of his new book, but he was on kind of this fluff tour on one of the NPR and so forth, and he keeps going over how he has a DNA of caring because that's just who he is. He grew up in Brooklyn, his dad's pharmacy, and he has the DNA of caring. It seems though that he applied kind of an instrumentalism, kind of a brute force approach, where he wasn't really showing the DNA of caring unless it was about the caring about the mRNA. And conversely, I think you're pointing out something there that's, say, more in the populist realm, that people approach their illnesses differently, and there has to be kind of some rub between kind of the brute force method where we're going to statistically wipe something out as a virus and so forth, and the concept not rip but kind of penetrate. And you have a really pithy reply to that about I forget with whom you were talking about, Sweden, about letting schools be instead of ripping off the virus. Anyway, there's just some fodder there for you. I wonder what your thoughts are.
Yeah, actually, I got to read his book. It's called On Call. It's his, I guess, his memoir that he wrote. I wrote a review for it that's going to come out hopefully very soon in Reason Magazine. It's a very interesting book. So first of all, I agree with you. He's a very smart man. I mean, and he lets you know that he's a very smart man from almost the very first page of the book. And he brags about his grades in elementary school, I think, in the book. I mean, it's kind of an interesting book. But it's clear, it's very clear that from almost the beginning of his career in medicine, people were looking to him as a smart man, as someone who was had good clinical instincts, it's also very clear that he does care about especially HIV patients. That has colored his entire career, his thinking. I think he came of age essentially when HIV was a new disease, and he played a pretty central role in mobilizing the bureaucracy of the United States to address to research HIV and to funnel resources in, and appropriately to funnel resources into the discovery of treatments for HIV, and then the application of those treatments very broadly, not just in the U.S. but in Africa. I think all that's very admirable and good. His particular skills does and you nailed it, Randy. He does seem to be in bureaucratic, in manipulating bureaucracy. I think there are very few figures in American history that are better at that than him. He's almost 40 years as the head of the National Institute of Allergy and Infectious Disease. That's a tremendous achievement, and it's both good and bad, right? You aren't there because you are very good at getting the public to give resources to that thing. It was the most important, probably the biggest. It was I think $8 billion of the $40 billion budget of the NIH went to the NIAID. I mean, that's a testament to Tony Fauci. So there's certainly that achievement, but at the center of it is also this tremendous hubris, this idea that everything that he believes is the science, and everything that anyone else who disagrees with him is against the science, right? Very famously, I think he gave an interview with CNN where he was asked about I think some criticism that Rand Paul had leveled at him, and his response was, "If you criticize me, you're not simply criticizing a man; you're criticizing science itself." Randy, just think about that. Like it reminds me of Louis XIV, the king of France before the Revolution. L'état c'est moi. I am the state. There is nobody alive ever in the history of humanity that could ever actually honestly say with any degree of truth that he is the science. It's just not. It's not. Science it requires a certain level of humility in face of the tremendous uncertainty we face. Science is a really important set of tools to try to unpack that uncertainty, but it's not a set of facts, or certainly not a human who believes a set of things that are infallibly true. There is no such person. Never has been.
So I'm not giving you the benefit of speed reading my second Fauci article, but I spent a lot of time on it, and I think there was, in a sense, kind of Fauci 1.0, Fauci 2.0. Something happened along the way around the time of, say, February, March 2020, and Dr. Fauci abandoned a lot of his precepts, which I think are reasonable ones in medicine. Oh, I wanted to bring up one other thing, because you mentioned HIV and how he cared about the HIV patients. When I was researching the same article, in one of those fluff interviews, he talks about his deep caring for the HIV patients. And who would know better than him about his deep caring, which he actually labels his own DNA of caring. Anyway, he says, however, I didn't listen to those voices. They were clamoring for more, seats at the table. They wanted to understand where we were with our treatment. We were too tight-lipped. We acted as if we were the experts and we shouldn't involve anybody else. We had a path and a pathway, etc. I'm extrapolating here. So if I were ever to do that again, I vowed to myself right after the HIV that I would listen to the community, that the community has input and their views are important because after all, they're the people affected by this. And so I read that. I was like, well, okay, what about COVID? I mean, the interview, of course, didn't ask this question. It's like, dude, did you just not ignore everybody in COVID? And mind you, you went back on not just ignore people, but you seem to have doubled weirdly down on kind of, Dr. Evilish kind of stuff, contravening your own precepts. And again, so there's a whole list of Fauci 1.0, 2.0, and one, I'm going to trot out my Fauci because I can. In 2005 for the flu, he was asked on a TV show. A caller said, I just had this year's flu, whatever it was. Should I get this year's flu shot? And he's like, no, obviously not. You've already had the actual illness, which is a much better panoply of proteins or antigens than the vaccine would ever give you. So no, so there's no real benefit to that anymore. And so he went back on that, by having these concepts of vaccines after the fact and then boosters, which I think is a total, anomaly of a name. I think it's an oxymoron, falsity, so forth. Did you notice any kind of Fauci 1 versus Fauci 2? And why did he say let it rip when you never actually said that? He talks about the Great Barrington Declaration, and I want to kind of center on that because that really, I guess, was the crux of his. You were kind of the irritant that didn't make a pearl out of him, but there were some pearls of wisdom.
Okay, so I actually did read your articles on him. I mean, they're really helpful, and I mean, everyone should read them. Jermaine, you did a good job talking it through. I have a theory actually about the HIV activists, right? So, very famously, Larry Kramer, a HIV activist, excoriated Fauci, called him a murderer, wrote a play where he was a villain. Yeah. But I think Fauci actually used that very skillfully to manipulate the bureaucracy. It's interesting. Some of his very best friends, even to this day, were those HIV activists, the same ones that excoriated him. And there was, there's again a very famous reconciliation. But even in the book,
so you're telling me there's a chance of a bromance between you and Dr. Fauci down the line?
I believe very fundamentally in forgiveness, Brandy, as you know.
So you think he can forgive you then?
Well, I don't know about him, but I've already in my heart forgiven him for any personal, and so I'll talk about the let it rip thing in a second, I promise. But I don't hold any personal animosity toward him. But I do think that he very skillfully used the existence of those HIV activists to manipulate the bureaucracy inside Washington to sort of funnel more taxpayer money to the research for HIV. And again, I think I'm not against that. That was just he's very clearly. And there's an incident in the book where one of his activist friends / detractors says he's going to come out and protest against Fauci. And Fauci gets an email from his friend saying, "I'm going to protest you," and he's like, and when the protest happens in front of the NIH, the protester winks at Fauci, and Fauci smiles back. I mean, it was a kayfabe kind of game, kind of like that they played together. I think to generate public support for HIV research. And again, I'm not against that. I'm just saying that that's part of the skillful game that Fauci played to get the public to support something that I think was worthwhile, like more research for HIV. On the 2.0 version of Fauci, it strikes me as that there was none of that kayfabe. There was none of that awareness that the things that he was recommending post March 2020 were actually deeply harmful to the poor. I mean, closing schools, he's a primary driver of why schools close. He fear-mongered around the harm of COVID to children very early on based on almost no good data. right? I still remember a very early, I think it was like April or May of 2020. He was in the Senate talking with Rand Paul about the risk of COVID to kids, and Rand Paul appropriately said, "Look, the mortality rate from COVID infection in children is very, very, very low. 1 in 100,000, 1 in a million, somewhere on that order." And Fauci's response was to cite some dumb article from Italy where there was a Kawasaki's like condition that's inflicted, that's like hitting kids with COVID, and it turns out to be like this sort of unfortunate but very rare autoimmune response that's treatable for most kids in response to getting COVID infection.
Yeah, it's like reverse cherry picking. It's like rancid cherry picking.
Yeah, I mean, and the whole purpose was to like scare the living daylights out of parents. Say, look, your kids are at least at risk as you are, right? Again, taking a rare risk, and then in order to downplay a very common risk, which is that if you keep your kids out of school for years, you are going to harm them. Some of them are going to get really depressed and anxious. Some of them are going to commit suicide. They will have lifelong learning loss that will harm their futures forever. And that will have consequences, including shorter lifespans. Because if you keep kids out of school, they're less well-educated, they're more likely to be poor, they're more likely to have to be less healthy in future. There's a large body of literature that says that, and that is at scale, right? So he failed to balance the risks there appropriately, and in his public communication, fear-mongered out of line with what the medical literature actually was saying. It's almost, I mean, and he had absolutely no sympathy for the harms of the policies he was suggesting. The comment about let it rip is absolutely in line with that, right? So what did we say in the Great Barrington Declaration, in which Sunetra Gupta, and Martin Kulldorff wrote in October 2020? We wrote was that the risk to children was very, very small from COVID itself, but the harms to children and others were very, very high from the policies implemented for COVID. At the same time, there wasn't insufficient attention paid to the risk of COVID infection in older people, that we were not doing a very good job protecting older people. I still believe that. Like 40% of the deaths from COVID were patients in nursing homes. That's something that should never have happened. So the Great Barrington Declaration said, protect vulnerable older people better, devote resources, thinking, and energy to protecting vulnerable older people better from COVID. And at the same time, for younger people, lift the lockdowns. Don't harm them, because there's very little benefit to them from the lockdowns, but quite a lot of harm. Hundreds of thousands of people in March of 2020. There was a UN report that said that 200,000 children had died in South Asia as a consequence of the economic dislocations caused by the lockdowns. The UN World Food Program estimated that 130 million people, this is April of 2020, would starve, would face dire food insecurity as a consequence of lockdowns. The World Bank estimated 100 million additional people in dire poverty, that is of $2 a day or less of income. So the poorest people in the world were harmed by these policies that Tony Fauci was arguing for, and they were useless. The question wasn't let it rip. The Great Barrington Declaration does not say the words let it rip. The first time I'd heard those words imputed to the Great Barrington Declaration were in the mouths of Tony Fauci, not me. And as a result, there were hit pieces all over the place, essentially saying, I want to let the virus spread. We don't have a technology to stop the virus from spreading, Randy, right? It essentially is premised on a lie that we have some capacity to make the virus not spread.
Yeah, I actually would take kind of the, point further than you, which is, letting it rip is actually, first of all, I don't think you let the virus rip. The virus does what the virus does.
Well, that's the thing. That's the key point, right? Look, the lockdowns didn't stop it. India locked down harshly in March of 2020, and yet by July of 2020, 70% of the Mumbai slums already had 70% seroprevalence of the disease in the Mumbai slums by July of 2020. You tell me the virus ripped during the lockdowns? Yeah, because the lockdowns do not stop the virus from spreading, especially among people who cannot afford to stay home Howard Hughes like and isolate themselves from the rest of humanity forever, right? And which is, only a very small fraction of the world population could do that. There's no question of letting, and of course, the vaccine also doesn't stop you from getting and spreading COVID. We have no technology to stop you from getting and spreading COVID. That is just a reality. It's not a question of letting anything happen.
But this is not, that bad an illness. If I had to choose, naive Spanish flu or naive SARS-CoV-2, I would pick SARS-CoV-2 to have as an illness for my society. I think, we don't really think of the influenzas as that lethal anymore because we've had the flu shots for, what is it, 60 years or 70 years, whatever. But, if you had a naive population, with the same technology, whether it's 1918 or 2018, and exposed to no flu shot at all, H1N1 versus SARS-CoV-2, I would take SARS-CoV-2 as the lesser of those two virulences. It clearly doesn't do that much. The Diamond Princess was out and about, and 3,711 people on board. And after the first month and a half, there were 0 fatalities. There were 10 by June, but long after the fact. And I'm not sure they were necessarily attributable to it. So there was basically had a close to 0 mortality rate, if not 0. And that boat skewed elderly because that's the people who can afford to be on the cruise ship. And there was a whole cohort of octogenarians, and they were the only ones who got symptomatic. The kids, tested positive, but they didn't have any symptoms at all. And so this was all known to the good good Dr. Anthony Fauci. In February, he mentioned it. He was at a lecture, and I listened to his talk on that, and he was aware of and tracking it. And then it just disappeared from his consciousness. And I just don't know what happened. And I'd like to think well of people, but I think this became means to some other ends, without being too conspiratorial about it. Whether those ends were to get an mRNA modality vaccine out, whether to achieve political ends, I have no idea what it was. But it was no longer population medicine. It wasn't good individual medicine either.
I have a theory. You want to hear my theory? I'll tell you the theory. Okay, so there's a premise of the theory. The premise is based on a lot of evidence. So it's going to take a little bit of history. So as head of the NIAID, going back decades, Tony Fauci had devoted a lot of the resources of the NIAID to the early identification of zoonotic diseases. So, like for instance, he supported very strongly the organizations like EcoHealth Alliance that would go out to the bat caves of China, bring back viruses and bring them into labs in city centers, including in Wuhan, China, and also in the United States, to do research on them, with the idea that, at least this is a civilian justification, with the idea that you could make vaccines early for them if you study them and you knew the ones that were more likely to make the leap. He supported very strongly gain of function research to augment the capacities of these viruses and pathogens in order to study them, he said, right? In order to see how many mutations would be needed to make them more infectious and more deadly to human cells and to humans, right? And in 2012, he wrote an article in Molecular Biology, a very prominent journal, where he justified this research agenda, saying that even if this research agenda causes a pandemic, the information that would come out of it would still have been worth it.
Yeah, I remember that.
He literally wrote that.
That's instrumentalism. That is kind of on the way to the F word. That is common to Mussolini and that mustachioed guy in Germany. It's corporatism, instrumentalism, and F word.
Well, I think the other thing is, like in 2020, he wrote this article with David Morens where he gave his vision for what society ought to look like. And essentially, the key idea is that all of human existence should be reorganized around the principle that we have to reduce the likelihood of spreading diseases to each other. We have to redesign our cities. We have to redesign our transport systems. We have to redesign everything about human existence around the principle that we are all mere biohazards, and that we should reduce the risk of spreading diseases to one another, infectious diseases. Essentially, reduce human contact, like change, the urban organization, everything around the idea that we are biohazards. primarily and mere biohazards, right? So that's his utopian vision. And the implementation of the utopian vision was this plan to go identify viruses in the wild. The scientific community actually rebelled against this in 2014, 2012, after a research program funded by Tony Fauci's NIAID had succeeded in weaponizing the avian flu virus, right, using gain of function work to make it more transmissible into humans, among humans. In 2014, there was a pause on this funding from the NIAID to this research agenda that must have really irked Tony Fauci, because this was part of his utopian vision. And he worked very hard. In 2017, he managed to get the pause reversed and put in place this sort of fig leaf of a regulatory process to try to like oversee the risky research. But that risky research continued apace, including specifically on coronaviruses found in the bat caves of China. And it seems very likely that this is exactly what caused the pandemic. The exact research program that Tony Fauci had championed caused this pandemic, leading to millions of people dead, and the lockdowns and all the economic harms and dislocations that come from that. That is, if you think of Tony Fauci as science itself, then science itself had caused this devastation.
That's pretty amazing. I actually cover that. I have my Eco Health Alliance article, so one of my brownstone pieces people can look at. I covered that, kind of the pause in gain of function research and Dr. Fauci's complicity with it. My Zika forays, fill in perhaps the gap between 2012 and 2020 a bit, because he was rather gung-ho about getting Zika funding there. And speak to his bureaucratic / political skills, the original Zika pandemic was, say, in the winter of 2016, and had kind of waned. And Congress was held up because there was the concept of promoting abortion as a palliative or a preventive. And the Republican, there was kind of split Congress. And so the Republican voices were hesitant about putting money towards the Zika efforts because they were aligning with these pro-abortion forces. Anyway, so everything got delayed longer than Fauci wanted. He wanted money instantly. So he actually proudly announced that he was taking or stealing money from diabetes and cancer research and putting it, on his own, going to ship it off to Brazil or wherever, and start a Zika vaccine foray, so forth, which never yielded anything to date. But he was very happy and proud about that. And eventually, he twisted Congress's arm to approve it by September 2016 when the thing had disappeared. So he does have this aspect of wanting something, pushing for it, and kind of this vision of which diseases are important and which aren't. Because along the way, treating COVID so monomaniacally, if you think about the actual QALY kind of the lives, years lost, where they're far more lost just even through narcotic overdose as a result of the increase, because of the disease of despair and despondency that happened during the COVID lockdowns, far exceed those lives potentially saved by any of the measures they did.
Yeah, no, I absolutely agree with that. But let me just square the circle on this, or just complete the argument on this. You have on the one hand this research agenda that he's promoted for years and years and years of essentially identifying pathogens in the wild, weaponizing them, and then of course also then developing vaccines or other very expensive treatments for them, right? So Zika is a good example of this, of the trying to develop a vaccine that never comes about. The mRNA platform is a long-standing idea that the NIH has supported. Many of the Moderna patents, Moderna had to pay patent royalties to the NIH because the mRNA platform essentially was developed in part by NIH scientists. Then so you have let's have an agenda for identifying, weaponizing, and then developing treatments for or preventive measures for viruses in the wild that have not yet made the jump into human populations. Now COVID happens. He's getting reports, very likely got these reports in late fall 2019, that exactly in the city where he supported this work, exactly on the kinds of viruses for the work that he supported, um, to research on, including this kind of gain of function work, there's an outbreak of disease that looked like a SARS virus. Think about the psychology of that, Randy, in his like, what would you do if you faced that?
Yeah, double down.
Yeah, I mean, I personally would say, okay, I'm going to be blamed for being one of history's greatest monsters because I have caused a pandemic, or I'm likely to have caused a pandemic. I will want to do absolutely everything I can to make sure that the harm from the thing that I supported that led to this outbreak is suppressed, reduced as much as possible. And who cares about all the collateral harms from the things I'm supporting? For me, all that matters is how many people get COVID, how many people die from COVID. And so I'm going to do everything in my power to make sure that so the mRNA platform, which it really wasn't quite yet ready for prime time, we're going to within days of January 2020, there's a vaccine target at the NIH. There's a strategy of using the mRNA platform in order to develop and deliver a vaccine within I think it was like January 10th or something. I forget the exact date that you have this vaccine target available inside the NIH. There's a video of Fauci touring a lab at the NIH, bragging about the mRNA platform and how fast they developed this vaccine for this as soon as they got the sequence for the virus. And then the lockdowns. Well, I mean, how do you, if the vaccine is going to save everybody, and so then Fauci and the NIH can look like saviors, you have to you still have to test the thing. That means you need to try to suppress the spread of the disease as much as you can until you can get to it, right? And, if you have a technology to stop the spread of it, it's a deadly disease, especially for older people. It's, of course, right to use it as long as the benefits of that are as long as the harms of that don't outweigh the benefits of it, right? But if you take that kind of logic, you would never have closed schools because the harms to the children outweigh the benefits to the children from this. So you can't have that logic. Instead, you have a logic of we have to reorganize all of society around the principle of stopping the spread of this one disease. And so you can put forward principles like Swiss cheese, where you don't have to evaluate any particular slice of the cheese. Cloth masks, oh, no problem. It might work, so why not just use it, even if they have lots of holes? Closed schools, okay, it might work. Why not just use it, even though it's going to harm a lot of kids and not actually particularly protect teachers or children, teachers or children, or even grandma from it? Lockdowns, all of that. Send COVID-infected patients back to nursing homes. Why would you do that? Well, because you're not thinking about protection of elderly people. You're thinking of keeping hospital beds open so that you can treat COVID patients so they don't die of COVID, even though they did die of COVID in large numbers and early on because they mistreated them with ventilators and remdesivir or something. So you have essentially all of the alignment of incentives for Tony Fauci to try to suppress the disease itself while completely ignoring all the collateral harms, and actually even ignoring the problems with the efficacy of the slices of Swiss cheese that he was putting forward. Because it doesn't matter, as long as it's positive, the marginal effect is positive, that's all that matters. It doesn't matter what the harms are. Ultimately, everyone's going to get COVID because we have no technology to stop it. That's the reality. But he doesn't care about that. All he cares about is let's delay until we get to the vaccines, and then
Right.
the
So,
NIH
if I were to capsulize your theory, it's like he has kind of a complicity in having brought the thing about because of his pushes, see above, zoonotic illness and whatnot. But rather than come out and say, "Oh my God, mea culpa, mea maxima culpa," I'm really sorry about this. Let's attack this. I don't think it's that bad a virus. We'll get over it. We should never have funded it. We'll look into those things in the future. I resign if I have to, whatever. But I thought it was the right idea, and so forth. I stand by the idea, even though it didn't play out well. It's one of those things, like the Bill Belichick, Pete Carroll in the Super Bowl. Made a decision, didn't turn out right, but he stands by it. Whatever. But instead, I think maybe if I'm reading what you're saying correctly, he's trying to extrapolate a new cloak of greatness, making lemonade out of this lemon. And so the lemonade is he's going to bring mRNA vaccines to the fore. He's going to keep the population relatively virgin as much as possible. So eliminate any possible intercurrent treatments, ACQ, ivermectin, and whatnot. Quiet all that down. Keep the EUA possibility there so that he can come in as a white knight with the mRNA modality, and then bringing all kinds of new treatments for personalized care down the road. And everyone's going to say, oh my God, if we hadn't had that mRNA come into the fore as quickly as possible, because it's been decades in the making, never passed phase 1 trials. But here, even though there are a few eggs broken, we have a wonderful new omelet now of mRNA technologies. Thank you, Dr. Fauci.
Yeah, I think so. I mean, I think that's the basic thing. Like, he was going to be the savior by investing in the technologies that lifted the threat of this deadly disease. I mean, I do think, maybe like, I don't know if there's a point of disagreement or not with you with just a little bit, but like, I do think that it was appropriate to try to protect older people as best you could especially in 2020. When you didn't have, when we didn't really know a lot about the disease. I mean, I think that's completely reasonable. This is why, like, sending COVID infected patients to nursing homes made no sense to me, right? Because of course you wouldn't do that if what you cared about was the lives of older people,
yeah.
Right?
In New York City, they had the Javits Center, and the Trump had brought the USS Comfort, but because the Democrat, Democrat-oisie, de Blasio / Andrew Cuomo didn't want to give kudos to Donald Trump. They abjured the USS Comfort and the Javits Center beds, and they brought them to nursing homes. They could have put them in a way station, temporarily. Anchor's a way station in the case of the boat, but they didn't, and they so this is kind of a lot of like a political football aspect to it. But yeah, they brought him to the nursing home, which is the worst thing. I'm not disagreeing with your part about keeping the vulnerable safe. We had my 92-year-old mother-in-law, may she rest in peace. Now she survived COVID and has since passed from other reasons. But we had her in the basement. She would have come out. We would have let her out if she wanted to go. Anyway, for a decade, and all through COVID. So I'm aware of that. We were reasonably careful with her, but if we weren't ill, we didn't mask up. She survived all that. She survived looking at my face, which is a plus. So she must have been relatively hardy. But she was nursing home quality of life at that time. She really was just bed to chair, that kind of stuff. And so I understand the drill, but I do think that we went way overboard. We isolated people. We didn't let people have love. And even if you were, when you're in a nursing home, the average, right, even today, or 2016 or 20 whatever. The average life expectancy for somebody in a nursing home is 13 months. We're not talking about people with long life expectancy, and I don't want to kill them off on purpose or anything like that. But having 45% mortality rate amongst that cohort is not shocking per se, because they pretty much have almost a 45% mortality rate in a year anyway, and or more. So but the whole thing was distorted based on kids having 1/100,000th that level of risk, and so forth. Anyway, I think we kind of mostly in agreement on that topic. I kind of want to switch to the legal aspects, which I guess started as Missouri versus Biden became Murphy versus Missouri or whatever. What happened to and with that case, I still can't believe the denouement, and where do we go, and what are the other cases relevant, and how do we kind of protect ourselves from the heavy hand of the government?
Yeah. So, one of the things, just to link it to the conversation we've just been having, one of the strategies that was really vital in order to get the lockdowns to stay in place was that the government needed to suppress the possibility of speech that criticized the lockdowns, that criticized the school closures, that pointed out the harms of it. Because if you had reasonable people pointing out that they were harmful and that were not particularly effective, well, then the political coalition that would support the lockdowns would collapse. This is, by the way, the reason for the let it rip and sort of the devastating takedowns and all that.
Horse dewormer.
Yeah, a lot of it was to essentially to humiliate anyone that would dare to contradict people like Tony Fauci. And it was, and I think now still is, the explicit policy of the American bureaucracy, and certainly, and now even the U.S. White House, that speech that contradicted COVID policy priorities of the White House should be censored. They used their bully pulpit. They meaning like the aides of President Biden, the CDC, the Surgeon General's office. They use their power to go and manipulate social media companies and force them effectively under threat to censor anyone that posted speech that contradicted their COVID policy priorities, right? So if you posted, for instance, that the Cochrane mask study showing that there wasn't very good evidence even before the pandemic that masks were very effective at reducing the spread of highly infectious respiratory diseases, respiratory viruses, well, you're going to get censored. If you posted about school closures, you're going to get censored. If you post that the vaccine doesn't stop you from getting or spreading COVID, you're going to get censored. The social media companies put in place automated algorithms, AI algorithms, to identify posts that violated the things the government told them ought to be censored, and then censored them. They did this not just with these AI, and they used like universities to like as sort of like to launder these censorship efforts. So they gave a whole bunch of money to Stanford through the NSF, then Stanford Internet Observatory embedded themselves within these AI within these social media companies, and to hold these social media companies, oh, these are the posts that are like violating that are spreading misinformation, where the priorities are given to Stanford essentially by the government. Right, the NSF says, here's what we think is important for misinformation, and so you have this sort of direct violation of normal standards of free speech rights in this country, and unfortunately, not just this country. It's actually all through the West. Tremendous pressure on these social media companies to censor otherwise legal speech because it contradicted the priorities of the policies of the administration. They even censored like honestly vaccine injured, like groups of vaccine injured people talking with each other about how to cope with the conditions that they have. Normal patient support groups, which are like you normally in medicine would encourage, but they censored them. They took those Facebook groups down at the behest of the direct threatening emails by the Biden administration. The Missouri versus Biden case. We brought this case, the Missouri and Louisiana Attorney General's office brought this case in 2022, August of 2022. I was a co-plaintiff in the case. And the discovering the case, we got to read the emails of the Surgeon General's office, the White House, the FBI, the CDC, and it's absolutely shocking, Randy. As an American, I never thought I would see the day where there's just this like blatant disregard for free speech rights as a matter of policy of the government, the bureaucracy, and of the administration. And the lower court judges who looked at this, they were absolutely aghast. And so in July 2023, Judge Terry Doughty in Louisiana, he ordered the Biden administration to dismantle this censorship complex. He called it a ministry of truth in his ruling. He literally called it a ministry of truth. The appeals court that looked at it, they made an analogy to Al Capone, the Chicago gangster who would go around to Chicago businesses and say, that's a nice business you got there. It'd be terrible if something were to happen to it. That's the nature of the way that the government threatened social media companies with regulation that would put them out of existence if they didn't comply with the censorship orders. And of course, most of them did. All of them did. And they ordered the Biden administration to stop. The Biden administration appealed the case to the Supreme Court. And I went in the Supreme Court entirely naive, thinking, how on earth is any Supreme Court justice going to find this legal? This is ridiculous. Such a clear-cut violation of the American First Amendment. It was going to be 9-0 in our favor, I thought. But we lost in the Supreme Court against was that issue in the Supreme Court was a preliminary injunction, right? The injunction against the Biden administration to stop coercing social media companies to censor. That injunction, it was put in place by the lower courts because it's so likely they were going to win the case that they wanted to put the harm from the First Amendment violation so egregious that they put this injunction in place even before the case has been heard. So you go to the Supreme Court. The Supreme Court looks at the case and they decide that I and the other plaintiffs don't have standing to sue, even though I was censored directly, with devastating takedowns by people like Francis Collins, like where we have emails essentially directing government officials to conduct devastating takedowns of me. You have like all this evidence of censorship, like Martin Kulldorff, who's posting. Martin Kulldorff was a Harvard professor on the CDC Statistical Advisory Board for vaccines. He posts post something saying, "Look, the case for vaccinating children is very weak." Essentially, whereas maybe you can vaccinate the old. And that's in April of 2021. And that post gets taken down at the behest of the federal government, right? Or proxies of the federal government. But that is apparently not sufficient to establish standing. Standing means that
who would have standing then? Nobody.
I mean, that's the thing about the way that they've structured it. You have to show a few things. You have to show an email from some government hack to a social media company saying censor J,
Right,
naming me. Then you have to show evidence of ongoing harm. That's not just a one-time thing, but that it's likely to continue happening. You have to show like that there's some
Collins used your name.
Action. I know. I mean, it's shocking. It's interesting because the majority that wrote the opinion, Amy Coney Barrett wrote the opinion. She even says they didn't look at the evidentiary record. I mean, it's in the footnotes that they didn't look at the evidentiary record. They just decided that we didn't have standing because we didn't meet some. And the rules for standing they created were extraordinary, like beyond what had previously existed. The dissent in the case, the three judges that ruled again in our favor, they pointed out something really important. If this is the rule now, then essentially the First Amendment is a dead letter, right? Because what the government can do is they can send an email to the social media company saying, censor these ideas,
right,
without ever naming any individual. And that means that no individual will ever have standing to sue. They could just censor ideas at will without any recourse. The First Amendment is an unenforceable dead letter in this country as long as the standing requirement pertains, right? So the case itself has gone back down to the lower court, and we're making the case at the lower court. I mean, the case is not dead. This was over a preliminary injunction. We're making the case in the lower court that we need more discovery. We need to read more of the government's emails to see if we do meet even the high standards set by the Supreme Court on what standing is. So I hope we're going to win that ruling. The other thing about the case is that there are other cases brought by RFK Jr. and Alex Berenson, a journalist, former New York Times journalist, who was directly censored, where they do actually have emails from the government to social media companies where they are explicitly named as targets of censorship. Mm-hmm. So I think even by the high standards the Supreme Court set, those meet the burden of standing. And our RFK Jr. actually, he petitioned to be joined to our case. The way and this is, I'm not an expert in legal matters, but from what I understand, if only one of the plaintiffs has standing, the whole case has standing. Mm-hmm. And so he's joined to our case. He has, the judge has already ruled that he has standing. So I suspect what will happen is that we're going to, this case is still ongoing. We're going to get our trial. Sometime in 2025 or 2026, we'll get, we'll go back to the Supreme Court. Well, it depends on who's president, because it may be the case that if you get a different presidential president with different priorities who respects the First Amendment, they won't want to appeal the case back. They'll just give up on the case, which is what the Biden administration should have done.
Well, I'm glad it's not a full dead letter. It is kind of amazing. At Brownstone, we talked about this a fair amount, and wondered whether the justices themselves had kind of a wrong knowledge of the level of emergency over COVID, and they wanted to kind of keep governmental emergency powers. That people say Amy Coney Barrett didn't have enough knowledge of the threat level, and she was exaggerating it. I have no idea whether that was pertinent or not. I mean, it's just supposition.
Well, the respect for free speech in the Supreme Court. I mean, this Supreme Court has seen traditionally as actually quite friendly to free speech, but yeah, it's shocking the level of deference they gave to the government. There are people on the Supreme Court that were saying that it's okay. I mean, this is like Judge Roberts or Kavanaugh, essentially saying that the government goes and pressures media all the time on national security matters to not publish stories, and of course there's nothing wrong with that pressure, because the New York Times can just say no and publish it anyways, right? There's nothing wrong with it. But here you have direct threats to the existence of these companies that they can actually carry through.
And it's different from the New York Times. I mean, I can't remember that statute, but basically it's like AT&T or Verizon versus the New York Times. I mean, one is a carrier, and I forget the statute, but the carrier is protected. If I'm on a phone call and I say X, Y, and Z on the phone call, AT&T is not liable because it's only a carrier. It's a passive carrier. And Facebook and Twitter at the time and so forth, they were working under the carrier status where they can't be sued for everything that's said. They're just the trampoline upon which other people jump. The New York Times is different because they are promoting a point of view and whatnot. But so there are libel standards for the New York Times that don't pertain to Facebook. So you can't have it both ways. In that example you're giving, they were. It's not about saying having a political opinion, hoping the New York Times jumps on board or doesn't. This is actually getting at the carrier status, like the AT&T, like phone calls. Facebook and Twitter on the same type of communication, DMs and all that kind of stuff, messaging that's happening. And you are really infecting and injecting yourself, to use a vaccine terminology, into the body politic, again, pun intended, with the intent of vaccinating them from ideas that are inimical to yours politically.
Yeah,
which
I think that like just again with the New York, I agree with you entirely on that, Randy. But it's like one other thing about the New York Times kind of analogy. The New York Times can directly say no, right? So if the government goes and pressures them and says, don't publish this piece, they can just go tell the government to go take a flying leap. And there's nothing the government can do about it. The censorship demand to censor me or my ideas, it doesn't come to me. I can't go tell the government to tell a flying leap. I just get censored at the behest of the government by the social media companies.
Yeah.
Right. So, the analogy is just inapt and frankly shocking that there are 6 justices in the Supreme Court, the highest court of the land, that would give credence to such an argument and then make up this crazy standing doctrine. They actually, to their credit, the majority did not rule that what the government did was legal. In fact, they explicitly said that they were not considering whether what the government did violated the First Amendment or not.
Right. So they were looking at a small piece of it. And we're kind of rounding out the hour. I want to let you put on your cape and go fight other battles, protect mankind and the American way. But any closing words for our audience?
Well, Randy, I think hopefully we'll get to talk some more. I would love to talk to you some more about your work on Zika. I think that public health, I still believe is very, very important. Like the institution of public health is very important. The key question to me is, given the devastation of the COVID pandemic and the tremendously malformed, destructive response by the public health establishment that has destroyed the credibility of the public health establishment, how do we reform these systems so that they can become what they really should be, which is a spur to human health rather than this authoritarian power that has no capacity to engage with actual scientific data or actual values of the population it's supposed to serve.
Well, thank you, Jay. Good luck to you. I hope to see you soon. And thank you very much for being on.